The Ontario Medical Association is pushing back against the move to allow pharmacists to diagnose and treat more ailments. The group's president says doctors receive thousands of hours of training and pharmacists may not be able to assess more complicated illnesses that could be a sign of a serious condition. Meanwhile, the CEO of the Ontario Pharmacists Association says any notion that there is an increased risk to patient safety is simply misinformation. The Ontario government is looking into further expanding pharmacists' ability to treat ailments to include sore throat, mild headaches, fungal nail infections, and nasal congestion. And Dr. Dominic Novak, president of the Ontario Medical Association, joined us with more on the OMA's concerns.
Our healthcare system is in crisis. 2.5 million people can't find a family doctor. And rather than looking at Band-Aid solutions, what we're advocating for is let's find everybody a family doctor and let's have health professionals working together for their care. And when I think about some of the ailments here, like sore throat, like headache, the number of times that someone's come into my office, I'm a family doctor, with that as the presentation, but it ended up being something serious. It takes a doctor to know that. That's our bottom line here.
And CB24's Jamie Goodfoy joins us with more reaction on this. Jamie.
Yeah, thank you very much, Lena. Right now, I want to bring in Justin Bates. He is the CEO of the Ontario Pharmacists Association. It's been a while. Thanks for joining us, Justin. I want to get your reaction to what the OMA just had to say, and specifically when it comes to the fact that doctors have thousands of hours of training hours to diagnose and assess certain illnesses, and the concerns they have that some pharmacists might not be able to assess that the same way as a doctor would, that could potentially lead to a more serious condition. What's your reaction to that?
Well, we want to work collaboratively with OMA and physicians. It's a very important relationship to ensure that both doctors and pharmacists are working constructively and productively together. And for the most part, that happens. I'm disappointed in some of the messaging coming out from some small cohort of doctors who are pushing back on this notion that there is a patient safety risk or somehow pharmacists are not trained or educated to do this. I really believe that is unfounded. If you look at the evidence, Ontario is one of the last provinces to enable scope of practice along these lines for pharmacists. Pharmacists have also hours and hours of training, education on prescribing and medication management. And in no way is this having pharmacists become doctors. This is something that they are trained for. They do look for underlying conditions as well as part of the assessment. And we know we can do this safely and effectively. And it's part of a broader solution to ensure patient access. And it's not just one model. There are several models here, and this is one of many that need to be implemented in partnership with primary care.
I'm curious, Justin, it was back in January that the province introduced that pharmacists could go about to treat these 13 common ailments, renew prescriptions for most medications, including whether it's a UTI, pink eye, or acid reflux. Are there any of those ailments that are currently on that list that pharmacists don't necessarily feel comfortable in assessing and diagnosing and prescribing? What do you think specifically that the OMA was pointing to that, might have come across as a little bit of a slight towards some pharmacists?
Yeah, we certainly hear concerns across various stakeholders, and we want to work with OMA and others to address those concerns because, I would ask everyone listening to the show today and moving forward, what's different about an Ontario patient or an Ontario pharmacist than is in any other part of the country where this is enabled and has been underway for many years, in some cases over a decade, with data to support how this can be done safely and effectively, aligned with the competency and education of pharmacists. So while we certainly want to work with OMA, I think we have to start with a respect for the fact that there's ethics around this and standards with our regulatory college, that we have the expertise, and we've already been doing this for well over a year and a half with 19 conditions, and 1 million people have visited a pharmacy took advantage of the trusted relationship they have with a pharmacist. And we know that that has certainly worked very well. And all of these are diagnoses that are self-diagnosis. The pharmacist is going through a step-by-step process with continuing education to support them. They're very comfortable in doing this. We have set up the stores and the pharmacies to be able to have appointment-based counseling rooms and all kinds of infrastructure to support this. And we need multiple solutions to create healthcare capacity and ensure that people have access closer to where they work, live, and play, and work with teams and work with physicians and other healthcare providers who should also have full scope to manage their patients appropriately. And
lastly, Justin, over the last year, I've covered this story multiple times, and a lot of the conversations I had with people was that they liked the fact that, if they didn't have a family doctor, that there was options that were out there. And when it comes to this list of ailments, do you see that list getting much longer? We mentioned a couple of those things just before our interview. Do you anticipate that we could see a lot more of those ailments be treated at pharmacies? We only have a couple of seconds left for this one.
Absolutely. There's 14 that have been recommended by the college, which also had physicians' input into an advisory group. And we want to get to where Alberta is, which is the high water mark, which is full autonomous prescribing for anything that's not a controlled substance. And Ontario is taking a very cautious and incremental approach here. However, it's very welcome. And I think patients have spoken loud and clear that they accept this and want more of it.
Justin Bates with the Ontario Pharmacists Association. We appreciate your time. Thank you.
Thank you very much.
Lean, we'll send it back to you for now.
All right, Jamie, thanks so much for that conversation.